So can you tell us a little bit more, David, about the different types and subtypes of lung cancer? I think for many people, they initially think that lung cancer is all one thing.
So there are a number of different types of lung cancer and a number of different ways of categorizing them. The most important thing to have is a piece of the tissue, a piece of the tumor that can be tested to see what kind of lung cancer it is. Probably the most important distinction that people make is the difference between the two main types of lung cancer. One is called small cell lung cancer, and that refers to what the cells look like down the microscope. And that represents probably currently about 10 to 15% of all lung cancers diagnosed in the UK today. It is normally associated very strongly with previous tobacco exposure, and is thankfully becoming less common because it's a very aggressive form of lung cancer. And so the other 85% plus is normally lumped together as something called non-small cell lung cancer. However, within that, you can make many different subdivisions. And that's really important because some of the major advances in the treatment of lung cancer, particularly at where the cancer is at a later stage, will depend on the specific type or subtype of non-small cell lung cancer. And it's an area of really massive development into how we can work out what kind of lung cancer you've got. And in future, I think what will happen is that people will be given almost a printout, a unique printout of their particular cancer, and it will have a very particular type of treatment planned for it, particularly if it's at a later stage. The earlier stages of lung cancer, particularly non-small cell lung cancer, the treatment is normally the same, but when a cancer is at a more advanced stage, it's really important to know exactly what we're dealing with and exactly what type it is.
And so from what you're saying, there is an ability to tailor the type of treatment depending on the type of cancer and how advanced it is. Is that correct? And can we do that for all the different types of lung cancer or just some?
I think it's more important to have lots of specific tests done on cancer which is more advanced, particularly in the non-small cell category. But it's important to know what you're dealing with. But part of the tests and procedures that people go through to diagnose a lung cancer is also to not just tell what type of lung cancer it is, but what stage it's at. How far has it advanced from the original part of the lung? So the primary cancer is where the cancer started. And as we're talking about lung cancer, obviously it will have started somewhere in the lungs on one particular side. And that's called the primary cancer, where it started. It can spread to lymph glands, but it can also spread to other parts of the body. And some of the common areas that lung cancer can sadly spread to are areas like the bones or the liver or the brain. And what we understand by that is if it's spread to, say, the liver, it's lung cancer in the liver. It's not a pure primary liver cancer. Equally, it's secondary bone cancer. It's not a primary bone cancer. And that's important because we treat the spread of the disease as if it was lung cancer, not liver cancer or bone cancer, which have different treatments. And so that's why it's important to make that distinction between primary and secondary cancers.